Hello and welcome. Thank you for joining us. My name is Tori, and I am Director of Pharmacy Programs and Network Development for Medicine on Time. I am joined today by Brittany Boyd at PQS, as well as Jermaine Robinson at Germ-Switch Clinic in Opelousas, Louisiana. I would like to welcome you both today. We are here to talk about end-of-year quality wrap-up. So we know this is a very busy time of year for pharmacy. Medicare Part D is in full swing. The open enrollment period is in full swing. We know pharmacies are doing COVID vaccinations still, COVID boosters, flu vaccinations. I know everybody's very, very busy, but I think it's also very important to begin planning for 2022. Pharmacy quality measures and the implications associated with that, financial implications associated with that, are still a part of the industry, and they're going to grow and be more and more a part of the industry as we move forward. So I wanted to bring these two together today with me and talk a little bit about what we should be doing to plan for 2022. So I'd like to go ahead and start by introducing both of you. Brittany, if you want to introduce yourself, that would be great.
Absolutely. Hello, everyone. I'm Brittany Boyd with Pharmacy Quality Solutions. I have been with PQS for a little over 3 years now. I have about 11 years of pharmacy experience working in a multitude of sectors in the pharmacy world. And so I come from a background of hospital, community, every type of pharmacy you can think of. Specialty is very near and dear to my heart, but I have now grown very affectionate also to the independent pharmacy space. It has been great to work here on the account management side with pharmacies and just assisting everyone with understanding their performance data and equip and having better ways to strategize that information. So it's been great to work with both Tori and Jermaine over the past year. And so I will pass it over to Jermaine and allow her to give her introduction.
Thanks, Brittany. Yeah, my name's Jermaine Robinson. I'm from Louisiana. I've been a pharmacist for 33 years, and like Brittany, I've been in all aspects of it. So that's been a blessing. I've learned quite a bit, but it's also been a blessing to have worked with Tori and Brittany this last year or so. I've learned so much because it's not about just filling prescriptions now. It's about the quality of it, and following metrics is so important. If you're not doing it now, you need to get on board with it. And I would love to help anyone paying it forward.
Thanks, Jermaine. And we kind of alluded to, the three of us have worked together a little bit over the last few years. We did a pilot with a PSAO, Pharmacy First. Both Jermaine and Brittany have been very instrumental in that pilot. We'll get to talking about that here in just a few minutes. But first, Brittany, I'm going to go ahead and pick on you a little bit. Since you're the expert when it comes to these quality measures, let's start out with just asking a few questions. So to start out, who should be involved in efforts to improve quality metrics in your opinion?
Tori, that's a great question. So we work with pharmacies, like I said, from all sectors. And the common assumption is that quality can only be focused on by the pharmacist, or to better make it even easier, those that have equip access. And we really want to instill that this is the entire pharmacy staff. So everyone has a part in how you perform on the medication-related quality measures and quality as a whole. Your patients even have a part in it. And so making sure that you're creating kind of a joint effort and being as engaging and connecting as you can with your pharmacy staff, your patients, the providers, all of that will ultimately contribute to some type of positive influence on quality metrics.
That's a very good point. And Jermaine, I know you have experience in that area as well, with Jermaine participating in our pilot. I think, Jermaine, you really started out being the primary person involved in all this, but then you ultimately pulled in your pharmacy technician as well.
Right. That's
right.
Correct.
Okay, so again, back to you, Brittany. What are the benefits of using the equip dashboard?
There's a lot of benefits to it, Tori. And again, I'm sure Jermaine will be able to list off all of them that are there. So utilizing the equip platform allows for you to have visibility into your performance as a pharmacy with your applicable data. And so as a reminder, just to everyone out there, what we do with the data in equip is we're actually consuming pharmacy adjudicated claims from the payers and then presenting that back through the Equip dashboard for pharmacies to see. The additional part of that is understanding that you have not only patient level opportunities, but also your payer level opportunities. So being able to go into the Equip dashboard and see what type of payer programs your pharmacy is eligible for based on that data is really key, along with partnering with your PSAO to kind of understand where your positioning is with those payer programs. And so being able to access the Equip dashboard to kind of see your progress in that, being able to check an overview of your patient outlier status, which is going to be your opportunities for improvement. All of those things are really key benefits of utilizing the dashboard. Alongside that, we do have educational resources also available in Equip that will navigate you through not only the quality metrics, but other spaces of pharmacy that may be helpful for your staff to understand.
All of that is so important. And honestly, what I find is a lot of pharmacies that have access to the Equip dashboard, they really haven't taken the time to really figure it out. And that's why you've been so instrumental in this pilot that we've done with Jermaine and her pharmacy, because you've really been able to show us and maximize the use of that, of all the information that's available on that dashboard. So where can pharmacies find their patient opportunities, like drilling down specifically to those patients?
Absolutely. So in the Equip dashboard on the home page of your screen, you all will find the Outliers button. And that Outliers button is typically the space where we've seen most pharmacies kind of go to immediately. As the first space they look to is, how can I go through and just go right to my outliers, which is really a great feature for you to have. So under your outliers, you will see the patients that are negatively impacting your performance score. For certain payers, we do also host data for patients that may not be below the threshold for the measure. They actually just may be late to refill. And that's another great opportunity for you to be able to connect with those patients. And some of that data is available on a weekly basis.
Okay. So I know workflow in pharmacy is so important and you have to maximize your time. And so when do you recommend that pharmacies really should put that extra time, aside to look at their dashboard and look at those measures?
Yeah, so I recommend that pharmacies actually take a peek at least once a week. Again, like I had previously mentioned, those patient opportunities, they can be updated as frequently as weekly, right? And so we have that data. We recommend that pharmacies are checking it at that time. And then as less frequently as monthly, at least once a month is what we are really trying to hone in on. The platform takes less than 15, maybe 20 minutes to go through, Tori. Jermaine, I know that you can attest to it, of not even realizing how much you can consume in how little bit of time. So we recommend taking 15 to 20 minutes at the very least once a month, mid-month, when the performance data is updated, so you can see your new performance scores, and then as frequently as weekly for you to check those patient level opportunities.
And for those pharmacies that are working with the PSAO, that don't hold their contracts directly with the payer, why do you recommend communicating more with your PSAO?
Well, there are actually a number of factors as to why. One, your PSAO is ultimately who you are, connected with for more than just the quality space. There are a lot of different services that your PSAO will offer to you. And so that's key factor there, number one, right? The second level to that is from a contracting space of just understanding, well, what am I up against, right? What are the expectations for me from a performance quality standpoint moving into the next calendar year or even the year that you may presently be in? For this consideration of 2022, we understand that we're, again, as healthcare is ever evolving, we're moving into a newer space with maybe higher thresholds of expectations. And we'll probably at some point, Tori, maybe be able to share that with everyone of what that may look like. But understanding that your different payer programs will obviously have different goal expectations. Even some payers also offer different outcomes programs. And so being able to connect more with your PSAO to kind of understand where your group of independent pharmacies are in that space are going to be really key for you to then understand where your performance metrics are in the dashboard.
Okay. One of the things that when I was working with Jermaine early on in the pilot, where you really opened our eyes, we were not at all familiar with the payer program portion of the dashboard. So could you tell us a little bit about that and what pharmacies can do to help improve their performance there?
Yeah, so the My Programs portion of the dashboard, there are like the headers and equip. And so My Programs for those pharmacies that have applicable data for the programs we partner with, you actually can check your status and your progress in certain payer programs in that space. So for all payer programs, they're looking at a certain group of medication related quality measures. And so not the same measures affect all of the same programs. And so being able to see those programs separated out in that space in My Programs gives you a better visibility into that. The same way with the home screen of your Equip dashboard, where you can actually select your outliers, there are also outliers for those specific payer programs in My Programs as well. So not only can you check where your performance is, understand if you're actually meeting the goal or how far you are away from it, you are now also able to see those patient level details to know, well, who can I directly impact? And another added kind of recommendation I'll give to that, Tori, is that cascading your patients, your outliers in the Equip dashboard is actually an even more efficient way for you to be able to positively contribute to your performance measures in a shorter amount of time. So as an example, let's say we have 3 patients, John Smith, Rachel Smith, and Julie Smith. And we see that John and Julie are, falling in that 60-50% range. Well, we know that we actually can't get them to that 80% threshold before the year is out. But Miss Rachel Smith has a PDC score of about 78%. And we know that because we've cascaded them in that order in the outlier file. And so now we're able to say, okay, well, maybe with Miss Rachel, we can actually get her over that 80% threshold and positively impact the measure along with the program with less fills than what it would take to help John and Julie. So that's another really key takeaway that's going to be very important for pharmacies, especially towards the end of the year here, but also as a key factor to incorporate into the 2022 plan.
Right, and I think that was something that Jermaine and I, working in the pilot, we found that really valuable because it can be very overwhelming to a pharmacy when they first go out to their dashboard and start looking at their outliers and see, okay, where do I even begin? And being able to cascade the outliers in that way was very, very valuable to us as well. The other thing I wanted to kind of touch on with the payer programs is I think that everybody's driven by dollars. And one of the things that I found very valuable in the payer programs is it actually does give you some numbers out there to feel like you really have some goals that you're trying to reach as well. So yeah, I just wanted to comment on that as well.
Yeah, absolutely.
Okay, so I'm going to actually go ahead and switch over to Jermaine for a few minutes. Jermaine, if you don't mind just starting out by talking about the pilot that we did, your work with Medicine on Time, your work with Brittany, what we were trying to achieve, and kind of your experience along the way. That would be great if you can kind of fill us in on that.
Sure. Well, when I took over the pharmacy, there was really no paying attention to anything. They were just filling prescriptions. I came from a background where I worked for a big chain pharmacy, and I want to say back in 2009, they introduced us to MTMs. So I had been doing that, which was a great thing. So I knew something needed to be done. And out of the blue, I got an email or a phone call from you, Tori, talking about a pilot program. And I'm like, well, that sounds fantastic. So with your help, with Brittany's help, we just figured out what to do. And of course, I was familiar with Equip, not at all what I know now, but I knew that was an important thing in the game. You need to look at that Equip dashboard. So with your help and Tori's help, we were able to find some outliers, and perfect opportunity to start packaging this. And that's how it all started. And it's a no-brainer. We will be we'll have provider status eventually. I'm sure of that. So if you're already doing this, you can do e-care plans. It's important to be familiar with your computer software even, and it'll all tie it in.
So tell us, let's break down a little bit more. So within the pilot, let's talk about, and of course, all the way through to today as well. Let's talk a little bit about what you've done and how you have gone about improving your quality measures.
Sure. Well, I focus on MTMs, and it's like Brittany said, your MTMs and Equip dashboard I check it weekly. And now, we have technology. Even if you forget or you're so consumed with work, you have a phone. You can check your equip. I've got that sucker in my phone. And so if I forget during the week, it's Saturday, I'm like, oh, I didn't check my equip scores, And of course you have outliers that might discourage some people, like, oh, they're always showing up. Well, hey, let's package those, and the beauty of packaging the medicines, you medicine the patient. They're not in and out every day or, every week. They're coming to get all their medicines that one time, and it's 30 days. So you have that 30-day reimbursement versus 90 days. It's, you have them once a month. If there's a problem with their medicine, they'll tell you. Whereas if they get 90 days in a bottle, you might not see them for 3 months, and then they'll come in and say, oh, it wasn't working for me, I just stopped taking it. Whereas at the end of that month or during that month, you can say, well, wait, don't just stop. Let's call your doctor. Let's switch it up or something, There's no lapse in care for them at that point. So that really is important to me.
Mm-hmm. So if you could tell everybody, the difference you saw in your quality measures and then the financial impact that you were able to see from that as well. I think a lot of pharmacies don't think that they can impact their pharmacy financially when it comes to DIR fees and pay for performance opportunities. A lot of pharmacies feel like, oh, that's too much work, or we can't, that's not achievable. So can you tell a little bit about that experience as well?
Yeah, actually, I don't even know if I had any stars when I started, but just from doing that pilot program, I went from 3, I think, initially to 5 stars, and I've been consistent with that for over a year now. And I look at my scores, and I know when it's coming up on the 15th of the month, and I'm like, let me still be 5 stars, and it's amazing. Sometimes I might be off by a little percent, but look at those outliers, look at those, the payers. And it's funny because before I was like overlooking for too many patients, whereas on your dashboard, you can zoom it down to what insurance, it tells you how many outliers. Get familiar with your computer software, and you can run reports targeting those specific patients. So you're not wasting time on patients that aren't counting, although you want everybody to be taking their medications. Well, and then it all becomes a game plan. It falls into place, and it's just a routine. It's no extra time, no extra salary. It's just myself and a technician, and we handle it well. And so my DIR fees have dropped, and from 2019 to 2020, I had a 500% increase on performance payout.
Wow.
Amazing.
Yeah.
That's inspirational, Jermaine.
And I'm not using any extra labor. It's, you have to manage your workflow.
Mm-hmm. And it's just knowing how to use the Equip dashboard, knowing how to look at those third-party payer reports, tying back to your Equip dashboard. It's a science, but it's really, once you get into it, it's not that complicated.
It's a routine. No, it
really isn't.
It operates itself. Yeah.
Yeah.
Okay.
Go ahead, Brittany.
No, I was going to say, Tori, I think to your point, making it a routine is really, truly important. Jermaine and I, we worked on that a lot, just making sure that we're instilling those same kind of mechanisms and just, drilling it in over and over, that it's not as much of a defeated process as I think some pharmacies may think it is. And I do understand that the DIR fees, they weigh heavy. And it doesn't really feel good, right, when they see them and having to see those reports. But, if for nothing else, I hope that Jermaine is an inspiration for some pharmacies out there, because it's been tremendous to see that growth.
Yeah.
And I have to thank you too, Brittany. Jermaine and I, we worked together from the beginning, still, trying to figure things out. And every single time we had a simple question or a complicated question, or we just needed some help for somebody to just answer a quick question or hop on a Zoom call with us, Brittany, you were always there. And that's the thing that I encourage for other pharmacies. I mean, other pharmacies have access either through their PSAO or directly with PQS. You guys have great resources, and you were phenomenal in helping us and really made it simple. And so I encourage other pharmacies to reach out as well if they have questions.
Yeah, thank you, Tori.
Absolutely. And I guess on a pharmacist standpoint, we think, oh, they're not going to have time for us. We hate to ask.
Mm.
And that's just how we are. We hate to ask, but oh my God, it's just a phone call or an email, and it's
Yeah.
you'd be
Sometimes it's a
surprised.
simple thing.
Yeah,
Yep.
I mean, with Brittany, Tori, with the support staff with Medicine on Time, support staff with Pioneer, everybody's been so tremendous. I mean, they're there. You have to
Yeah.
ask.
It's great. It's great.
Yeah.
So as we kind of wrap it up here, anything that we haven't already covered that you guys would like to talk about? Any kind of like final things from each of you that you would like everybody to know?
You go first, Brittany.
Okay.
Jermaine had already touched on it and we spoke about it earlier. I would love to share my screen, Tori, if that's okay.
That would be great.
I would like to go ahead and just give everyone kind of a visual into those star ratings that Jermaine had spoke to. And so when we're looking at our star ratings for 2022, it's important to understand that CMS sets these thresholds every year. And a lot of it is based off of how Medicare members were performing in the 2 years prior. So the way that these cut points are set up for 2022, they are based off of performance from 2020. So I'm sure a lot of pharmacies will see these, 3, 4, 5-star ratings for the MAPD and PDP plans and think, oh my goodness, it's a huge jump from what it was last year. Well, we understand that 2020 was sort of an anomaly when we look at performance and the way things were set up, due to the COVID-19 pandemic. And so where we currently find ourselves at these thresholds are a little bit higher. And so while these are set for the MAPD and PDP plans, it's important to know that some health plans do set their pay for performance or other quality-based network programs off of these thresholds. Not saying that all of them do, but some of them will mirror what CMS has already proposed as a goal for the plan itself, that this also may be an expectation for the pharmacy. And back to Jermaine's point of being able to achieve kind of that 5-star threshold, this is what she's referring to. In the EQIP dashboard, we do update those goal sets every October. And so now when you look into the EQIP dashboard, you will see these higher star rating expectations, but these are for 2022 that you will see. So while we do see that 5-star goal up there for MAPD plans, and even the same, a very big jump for PDP plans, I have all the faith in Jermaine and all the pharmacies out there that you guys are going to hit that 5-star rating. And just want to reiterate that there is a lot of data in the EQIP dashboard that can really help you be able to achieve these goals. And just being able to take a brief step back as we talk about, with EQIP, that I want to encourage everybody to pace yourselves. It is not change is not instantaneous. It will not happen overnight. And so there's a quick webinar that you guys will have the recording link to, just about understanding the key takeaways of what this year has brought to us from a resource and education standpoint. But being able to pace yourself as an acronym, which would be plan, act, check, and engage. If you guys can do those 4 things with your pharmacy, I can guarantee you that you ultimately will succeed in your performance metrics and in the quality space. Jermaine has already acted on those things before we even created the acronym, and you have done tremendous in it. So when I say plan, I mean coordinate with your team, communicate with what the staff is supposed to do. From an ACT perspective, it's simply logging in at least mid-month, once a month, checking your outliers, and being able to kind of understand if we need to adjust the plan, we can do that. And being able to engage more with not just your staff, but your patients and the providers. If you have some engagement there with that and you continue that cycle, your ultimate continuous improvement process will succeed tremendously.
Thank you, Brittany. Any final thoughts from you, Jermaine?
Well, she just said a key word at the end, providers. It's time for us to go to the providers, because now they're going to be affected. They have been, they're just not realizing it, and they're in denial. But doctors, nurse practitioners, they're going to get scored based on adherence. So what a wonderful opportunity. I am in a perfect location. I have a physician on one side and nurse practitioner on the other. So and they know I use Medicine on Time for adherence packaging. So it's going to be a beautiful thing, because who are your troubled patients? And the doctor next door, she'll say, please package their medication. So at the end of the day, when they start to see their reimbursements go down for lack of adherence, I'll be able to print a report and show them our mutual patients. And Pioneer has a beautiful thing where you can do a report card on them. It'll show you their adherence percentage presented to them. Now you call other pharmacies and you see how your mutual patients with them are. Guess what? I am going to get more patients if that pharmacy's not, up to snuff. So that's a good way. It's a good way for you to benefit, the doctor to benefit, and they're going to appreciate the fact that you're doing this for them. Their scores are going to go up and the patient benefits from it.
Coordination of care is so important.
Mhm.
And I know that a lot of our pharmacies, and I think you too, Jermaine, you've actually already seen some referrals. Physicians are starting to see the value because our pharmacies, our member pharmacies, are starting to see more and more referrals from physicians that see, okay, this patient, the reason they're still sick is because they're not adhering to the treatment plan they put in place for that patient. And you're in front of the patient every month at least, whereas they might only see that patient once or twice a year. So that's a very, very important and very good point.
And again, if they're having trouble with the medication, you're the first one to find out, not the doctor.
Right. And that communication back to that physician is really important as well.
Yeah. They'll just stop taking it. And if they don't go back in 5 months, then they've been without a statin for 5 months.
Yep.
When it's a quick fix, let's just change the medication.
Yeah, it can be so simple. Yeah. I also wanted to conclude by talking a little bit about, Medicine on Time and what we offer. Jermaine has adopted our MOT Complete solution. You've been doing it for like 3 years now. Through this pilot, what we did is our goal was to first see the impact on PDC scores. So 3 of those measures on your dashboard, Brittany, are those PDC measures. So we really wanted to see how we could impact those. And what we found was overall for Jermaine's low performing patients, those PDC scores on average increased by over 30%. So that's huge. That is huge.
That is tremendous.
So using the right tools.
In 6 months. In 6 months.
In 6 months, Jermaine.
Wow. Crazy. So having the right tools, having a MedSync program, I know Jermaine, had a great software and that she used as well. And then having the right tools with the packaging solution that's going to help be very intuitive for the patient so they can better manage their medications. And then understanding the equipped dashboard, I cannot say that enough. Call Brittany.
Yes.
Brittany's amazing. Figure out what you need to know about the equipped dashboard. Stay on top of it, and then better understand your third-party payer reports, those CVS Caremark trimester reports. That's where we can help you as well. Because of our
the ones I used to throw away.
Exactly.
And we're not throwing them away anymore, Jermaine. We're not throwing them away anymore.
So we will help pharmacies with this as well. We'll help you with looking at your CVS Caremark trimester reports. As a Medicine on Time member, we will do that. So
if I can, Tori, I want to just add in that coming in 2022, we'll be back to talk about this, I'm sure, sometime next year. But
yes,
Nutto is coming. Cannot fully brand that will be the name of it, but Equip is getting a whole new look. Jermaine has been great as far as helping with that and getting some sneak peeks into what it's going to look like. But from a program perspective, we will have more targeted information on that piece so that you pharmacies, not only with you better communicating with your PSAOs, but now you can better see it in Equip and being able to have more of that visual. And so hopefully when we meet again in 2022, I'll be able to actually screen grabs of what that looks like.
Awesome. We're so excited to see it. So excited to have you back as well.
Yes. Awesome.
All right. Well, it's been wonderful talking to you ladies. Thanks again for your time. Anything more you want to say before we wrap up?
Just thank you both for the opportunity. And, I love working with you guys.
All right. Thank you both. All right. Take care. Bye-bye.
Thank you.